Dear students, welcome back. In the previous session, we have discussed about general structure and the curvature of the spine or the vertebral column. Now, in this session, we are going to discuss about the mobile segment. Okay, so normally the vertebral column functions as a closed kinematic chain, isn't it? That one we have discussed in the earlier video. And any change in the position of any one of the segment will causes change in the adjacent superior or adjacent inferior segments. Okay, so that one we have discussed in the previous session. So now we are going to discuss about what do you mean by this mobile segment. Okay, here the segment is we have to consider only a single vertebrae or a pair of vertebrae, isn't it? Because it is a closed kinematic chain, so each and every vertebrae are connected to each other from cervical to sacral region, isn't it? So now we should get the clarity of what do you mean by a mobile segment. Okay, now so the mobile segment is the smallest functional unit in the spine and it is called as the mobile segment. This functional unit consists of any two adjacent vertebrae with intervening intervertebral disc. That means two adjacent vertebrae. Okay, and in between them it should have intervertebral disc, and these two vertebrae are supported or secured together by some of the soft tissues. So some soft tissues are going to secure these two vertebrae together or support them together, or helps in the adherence of these two vertebrae together. Okay, so this one is called as mobile segment. Simply we can say the mobile segment is the smallest functional unit in the spine and it consists of any two adjacent vertebrae with the intervening intervertebral discs and all the soft tissues that secure them together. So now we'll see what are the structures which are going to secure them. So normally the two adjacent vertebrae are attached posteriorly by two facet joints. This is the posterior view. This is the posterior view of the segment, mobile segment. So these two are the facet joints. These two are the synovial joints, and these synovial joints are covered by a joint capsule, which is one of the soft tissue which are going to support this mobile segment posteriorly by the joint capsule. Okay, and the other structures are the number of ligaments which are going to give support to this mobile segment. For example, there are a number of ligaments, anterior longitudinal ligament, posterior longitudinal ligament, supraspinous ligaments, and interspinous ligaments, and intertransverse ligaments, and the ligamentum flava. These are all the number of ligaments which we will see throughout the vertebral column, and also these are the structures which are going to give support to this mobile segment also. So any damage to any one of these structures of the mobile segments leads to instability of the spine of that particular region. Okay, so now we will see such case called as spondylolisthesis now. Yes. So normally the spondylolisthesis means slipping of one vertebrae over the other. Okay, so here now we can see this is the normal spine here we can observe here. So in our vertebral column we'll have 23 mobile segments. Okay, so of course C1 C2 will also having a movement in between those two vertebrae, but it doesn't have any intervertebral disc, so we are not considering C1 C2 as the mobile segment, because if you see the definition of the mobile segment, it consists of two adjacent vertebrae with intervening intervertebral disc should be present. Okay, so totally we are having 23 mobile segments found in the vertebral column. Okay, so here this is the lumbar spine at the region, normal lumbar spine as well as the sacrum. So here this one is L5, here L4, L3, this one is L3, L4, L5, and this one is S1. So these are the individual vertebrae. Now what are the mobile segments now here in this thing? So what is the definition? So two adjacent vertebrae with intervening intervertebral disc. So L3, L4 is one segment, L4, L5 is another mobile segment, L5, S1 is another mobile segment. So here these are the normal things we can observe in this pic. Now here this is another pic. This is the spondylolisthesis happening in the lumbar spine. So this one is L4 and this one is L5 and this one is S1 here and L3, L2. Okay, so here if you see the lumbar curvature, so the lumbar curvature is affected here. So up to L2, L3, L4 you'll have the normal lumbar spine, and here it is disturbed here and it is going backwards like this. That means here we are finding that the lumbar curvature is affected here. So at which segment of the lumbar spine is affected now? So definitely very good, it is at the level of L4, L5. So the reasons may be many things. The causes are many. It may be some genetic causes, or it may be some injury to this joint leads to such kind of instability, or injury to the ligaments which also causes such kind of thing, and also there may be damage to the intervertebral discs, and some degenerative changes in the vertebral bodies also causes such kind of listhesis we can find. This is the spondylolisthesis. Here the slipping of L4 forward, slipping of L4 anteriorly, okay, over the L5, isn't it? So here it is moving here, and this one somewhat moving backwards. So here the slipping is taking place at this level. So which mobile segment is affected now? L4 and L5. The same thing we can see in the MRI of L4 L5 level. So here you can observe this point lumbar MRI showing spondylolisthesis at the level of L4 L5 level. Okay, so here also in the diagnosis also they are mentioning L4 L5. They are not mentioning only L4 is going to disturb or L5 is affected. They are not telling like that, or they are not diagnosing like that. So they are diagnosing in the form of segments. Okay, so which segment is affected? So L4, L5. So we can find the normal lumbar curvature here. So up to the L3. Okay, L3. So now the lumbar curvature is affected here. So here. So what is happening? Here the curvature got breakdown, and here the normal curvature is not maintained here at this level. So, and some slipping of L4 anteriorly, and L5 is moving backward. So here we can find at this level very clearly the instability of the lumbar spine. At which level? L4 and L5 segment is affected. Like that we have to diagnose or we have to observe which mobile segment is affected. Okay, hope my dear students you understand what is mobile segment and what is its importance. Okay, what are the structures makes the mobile segment. In the next session we are going to discuss about the structure of a typical vertebrae in detail. Thank you.